Hi everyone, this is Dr. Hall and I'm going to show you how to do a blood smear collection today. So the first thing I want to show you is actually a little bit of practice for how we're going to get the blood on the slide, because we want to make sure we get a nice thin film of blood, because if all the blood cells are on top of each other, then we can't really see anything through the microscope. So we need them to be spread out. So what we're going to do is we're going to place a drop of blood on the slide close to the white portion here. Take a second slide at an angle like this. Draw it back to the drop. Once it reaches the drop, it will disperse along the edge of the slide, and then we'll just slide this across. So I'm going to demonstrate that with a drop of blue water first, and I'm going to recommend that you practice this at home with just a drop of regular water that you can just put on your fingertip. And so we're just going to do a practice one first so you can see how this works, and I highly recommend you do this before you do it with your blood. So here I have a drop on the slide. I'm going to bring my other slide back toward it, and then I slide out like that. Now, this water doesn't work nearly as well as blood will, but that's the motion, right? So you want to bring it back until it catches the drop and then spread it out. So I'm going to go ahead and clean off my slides, and then I'm going to show you how to collect the drop of blood and how to put that on the slide. So here are my two slides, a little bit of blue water here. Okay, so first you want to start off with a nice clean surface, and you want to wash your hands with soap and water. I have all of my equipment laid out here. I have my alcohol pad, my Lancet, which is got the little device that's going to make a little finger stick so that we can get a drop of blood, two slides, some gauze or a tissue, and a Band-Aid if needed. So on your slides, there is one side that has this white or frosted area. One side is rough, the other side is smooth. You want to have the rough side up, and you're going to write your name on that side so that when your slide comes in, I know whose this is. Okay, so once you have that ready, then the first thing you're going to do is pick a fingertip. I like to use my ring finger. I don't know why. You're going to open the alcohol pad. This is just to kill any germs or bacteria that are still on the skin after you've washed with soap and water. So I'm just going to rub off the surface of my skin there to kill any bacteria that are present, and just let that air dry. Now, to use the Lancet, this little blue tip here, you're going to twist off like that, okay? Then you're going to put this hole against the pad of your fingertip, press down onto your fingertip, and then push this button with your thumb. And that's going to make a little finger stick. You're going to squeeze your fingertip just a little bit to get a little drop of blood. We don't need a lot. Touch it to the slide. And then draw the slide back and smear it out. So I don't know if you can appreciate, I'll come up closer. There's a little faint red smear on the slide here. Maybe if I put the gauze behind it, right? So it's very faint. That's exactly what we want. Then you're going to set that down and let it air dry. Put your gauze or your tissue on your fingertip and hold pressure. So let this air dry. Once it is fully dry, then you're going to put it in your slide case. So slide case, there are little slots in here. You slide it right in there with your other slide and mail it back to us. So again, to review the steps, alcohol pad, well, actually first wash your hands, alcohol pad, do the Lancet, drop of blood on the slide, smear it, let it air dry, and then put it in the box to ship it back to us. All right, I'm excited to see what your blood looks like and share it with you.